Hello, Dr. Ferguson coming to you from the Passion Cam. It's been quite a while since I've done one of my Passion Cams, so please forgive me for that, but I thought it was time to get started back doing my Passion Cams, and it's prompted by a conversation I had with one of my patients just a few days earlier. And he's in my Suboxone program, which is a detox program, and that's when you've been hooked on opioids, and then we're trying to get you off of opioids, and we use a drug called Suboxone to do that. And we got to talking about his progress and how he's doing, and we got to talking about the group therapy. And this is where this Passion Camp is going to come in talking about group therapy. I think group therapy is an excellent thing to do, but you have to evaluate the group therapy. When you leave that day from your therapy, did you feel better or did you feel worse? Were you in a room of a bunch of negative people, or were you in a room of positive people that feel you can do it, you can make it, and keep pushing and keep going forward? Or were you in a room of negative folks who are saying, oh, you'll never make it, you'll always need the drugs, you'll slip here and there, and you know, what can you do, and just that kind of thing. And so I just encourage all of you that are going to group sessions, and I think group sessions are good things. You know, having a counselor is good, as well as group sessions are good. But assess and evaluate how you feel when you leave. And when you leave, if you feel uplifted, if you feel like, yeah, I can do it now, I see some others that have done it, they encourage me, I can move forward, I'm going to have success at getting off these drugs. If you feel that way, then the group session is good. If you leave there feeling, oh, I'll never be able to make it, well, I see these people I thought could do it and they didn't do it, and I know I'm going to have to take these drugs the rest of my life, I know I'm hooked for the rest of my life, well, then that's probably not a good group session for you. So on that note, to all of you who are struggling with an addiction, we're talking about opioids today, but it could be a group session with an addiction about anything. It could have been alcohol, could have been cocaine, could have been any particular topic. So on that note, when you're going to have your group session, evaluate it. How do you feel when you leave? Do you feel better? Do you feel worse? If you feel better, probably a session, a group to continue to work with. If you feel worse, then it's probably a group session that maybe you should find a new group session. Now, let me quantify that feeling worse or better. I just thought about one thing. Now, if you're feeling worse because they've pricked your conscience and they've gotten you to really stop and think about what you've done or haven't done, then that's a good thing. But if you leave there feeling discouraged that you're not going to be able to make it, you're not going to be able to be successful, then that's a bad thing. So on that note, Dr. Ferguson coming to you from the Passion Camp. Be blessed and have a wonderful day. Bye-bye.